Okay, this is a video on how to prescribe variable rate insulin for maternity and how to use the care plan. So the first thing we're going to do is identify a patient that we want, and we're going to search for the care plan. I'm going to do it through Request Prescribe. Doctors can also do it through Doctor's View. In the case you add, and you search for the care plan. So the care plan we're going to be using is called Insulin VRIII Care Plan Maternity. So click on that, and it brings up the care plan. So the care plan is split into two sections. The first section is information regarding prescribing and a link to the guidelines. And the second part involves the infusion rates table and which algorithm to select according to their blood glucose in line with the guidelines. So once you know which algorithm you'd like to prescribe, the algorithms are listed here. Notice the other ordables within the care plan. So potassium is pre-ticked, as are the lab requests for urea and electrolytes. If these aren't needed, they can be unticked. And in order to prescribe the insulin algorithm you want, you would click the appropriate box. Once we've done that, we would order for signature. If the consultant name doesn't pull through, you can add it here, and this will be the consultant here. This is a pop-up that suggests that interaction checking can't be performed for the fluids. We're going to accept that. It's asked me for an allergy for this patient. I'm going to click through. This is a test patient, so some of these may flag up some alerts, but for all patients that are admitted, that should have been done already. In order to modify the insulin, we would click into the order here. You can see that the rate has been preset to a variable rate. At this point, we don't need to add anything. The bag volume has been pre-filled to be 50 mils, and the additive, so Act Rapid, has been pre-filled to be 50 units. So to make up a standardized 1 unit per mil dose or concentration. You can see here in the infusion instructions, we have the dosing table for the rate. So that will pull through onto the drug chart, which I'll show you once we've prescribed it. So apart from that, we don't have to change anything. Potassium here is listed as well. If the dose, volume, or rate need to be changed, you could do so within the table. We're going to leave it as it is. The only thing we'll need to put some mandatory information in is for the laboratory request, and that's indicated by this blue circle with a white cross. That means the system would like you to add some information to that order. It's asking for the reason, so we can pre-fill the reason and a bleep. So once the information is filled, you can see the blue circle with the white cross goes away, and we can sign for it. That's completing the prescription through the care plan, and it should now appear on the drug chart. So by refreshing, we can refresh the new prescription, and you can see we have a variable rate insulin prescribed and the potassium bag prescribed as well. If we hover over the prescription for the variable rate, you can see the dosing table appears, and that's how we would review the required rate and compare it to the blood glucose level that's been measured. Now I'm going to show you how to begin the infusion and record it on the system. Do that through Medication Administration Wizard, which is at the top here on the banner bar. Clicking into it, we would scan the patient's wristband. I don't have a scanner, so I'm going to override this for now. Obviously, we wouldn't do that unless there was a malfunction with the scanner or a scanner wasn't available. So for the purposes of this video, I'm going to override that. Here we can see the scheduled medications. So this is the medications that are prescribed that are due for administration. You can find here our Act Rapid, so our variable rate. Click this box here. Again, usually medicines would be verified by scan. I'm going to override this as well. Then this blue circle with the white cross appears. That means we need to specify some information. And we do that here. Click the drop down. Then these yellow fields are our mandatory fields. This is where we'd put the rate at which we would like to administer or start the infusion at. I'm going to put in my cosign account first. Any intravenous drugs will need a cosign or a witness. Obviously, this would be someone else. Don't put yourself in that field. You always need a secondary witness for IVs. The site, we can choose the site at which the infusion is running in. Then here we put the rate at which we're infusing. This is important. At this point, it will not pre-fill any of this information. We will have to specify what rate we'd like to initiate the infusion at. And that's really important because we have to select the correct unit doses. The system cannot pre-fill what unit dose we'd like to give, so this will always be units per hour. That's important to bear in mind. Because it's a 1 unit per mil concentration, defaulted 50 units in 50 mil. The concentration is 1 unit per mil. So if we wanted to start the infusion at, for example, 1 unit per hour, the system will calculate the mils per hour for us. Equally, if I do 2, 3, so on and so forth. So I'd recommend using this field first, and then it will calculate the rate for you. Once we've done that, we press OK. Then wants us to sign for our cosign account. Once we've done that, you can see here it's ticked. We've pre-filled the information now. 1 mil per hour into the left hand. We can sign. That's now completed. By refreshing, we can see that on the drug chart that is now recorded, the time at which we've administered it and the rate. So begin bag, 1 unit per hour. So that's now recorded as started. I'll now show you how you can change the rate and make sure it's reflected on the drug chart as well. All of this is done through assessment/fluid balance. So we'll click into assessment/fluid balance. Within these, we would select medication-related monitoring and titratable infusions. Within here, actually taking a step back, if we wanted to record the glucose before we did this, select diabetes management. And here you can see the glucose level. In this instance, I'm going to insert a new date at time. Notice that each column is stratified according to hour. So for the purposes of this video, I'm going to insert a new column so that it recognizes this is new. Otherwise, it might think that we're changing a column already. And I'll put in by double clicking, entering a new glucose level. Pressing enter. And up here, I can sign it. That commits it to the system. So now at this time, or within this hour, we recorded that the patient has a blood glucose of 10. If I go into titratable infusions, you can now see this information is pulled through. I'm going to insert a new time and date again, because I wanted to make sure that the system knows this is separate to the unit dose that we started at. If I was to go in and try and amend this, it would recognize it as changing the initial rate. So we want to do it at a new time. Obviously, if you're doing this every hour, you can click into the appropriate hour column, and you wouldn't have to amend this, it would be blank. I can do this by right-clicking, adding result. It will now allow me to edit the time at which the new rate change is occurring. So if this person had a glucose level of 10, we would want to increase it to 1.5 units per hour. Pressing enter, this purple color means it hasn't been completed yet. So in the same way that we committed the glucose level to the system, we would then sign it. Notice now that it has the new rate, but it has a 2 next to it. That just means there's been 2 changes in rate within this hour field. For example, if I changed the rate at 10, then changed it again at 11, it would have they would be separate. This is just because the system groups everything into 1 hour. Okay, so once I've done that, I can go back and review the drug chart. If I refresh it, you can see now it's recorded a rate change at the time I changed it to 1.5. And in that way, you can change the rate and it be recorded at the time that the rate changes occurred. Once the infusion is finished, obviously this is a very fast forward way of doing it, but in reality, once the infusion has come to an end, the prescription can be discontinued through request prescribe, medication lists. I can right click on the prescription and I can cancel/discontinue. It will ask for a reason. So we can say no longer clinically indicated. It will fill in the time and date at which we're doing this. Order for signature. Again, you can review to make sure you're discontinuing the right product, so insulin Actrapid. Sign. Once we've done that, that is how you will discontinue the infusion. It can't be done through the drug chart, and importantly, that should be done by a prescriber.